Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic, and this is the 88th live video presentation on Facebook. This one is part 2 of our actual fibromyalgia treatment program. Just to review with you, first of all of these are saved. You can also find them on YouTube and also the Fibromyalgia Wellness Center. That would be my website. Many of them are saved right here on this video itself, Facebook itself. Part 1, just as a review very quickly, when a patient comes in and has been diagnosed and so forth and so on, and we've actually gone through the preliminaries. We place the patient on a restricted hypoglycemic diet where we take sugar, gluten, trans fatty acids, and dairy out of their diet. Not only are they inflammatory, but often are addictive, and they do cause additional health problems. And so what we try to do is take these out of their diet, find out which ones are actually bad for them, and that way the patients have a choice as to whether or not they want to continue being sick or not. They're only on this for about 2.5 weeks. It's a not only restricted hypoglycemic diet, but we place them on a very gentle detox. We also have the patients go on fish oil. The aspects of fish oil we already covered, anti-inflammatory and also a brain stimulant. We also place them on magnesium, which is because of the fatigue factor. We'll go into that a little bit more detail in part 2. And also conjugated linoleic acid, which burns fat off their body, because fibromyalgia patients, most of them are inactive, or shall we say, do not exercise. And so even if you're the same weight as you were last year as now, and do not exercise, anywhere from 5 to 10% of your lean tissue turns into fat. Hi Marla, how are you? Hope you're having a wonderful day. And all the rest of you that are joining, that's great. Invite, okay, you can go live, bingo, go like that. And add. There you go. Part 2 is very interesting, because this is the actual meat of the program. Once we take the patients off of that for about 2.5, 3 weeks, and then they add one food they've been restricted from every 72 hours, they find out whether or not they get sick or not. And that occurs very quickly. Look, if you've been off the food for about 2.5, 3 weeks, and then you add it, your body will respond very quickly, anywhere from 15 minutes to an hour. And that way you know that food is not good for you. A lot of people don't realize that they have problems as far as with sugar or gluten, which is wheat, rye, barley, malt, or trans fatty acids, and a variety of other things that might be bad for them. It's not a starvation thing. You have a lot of foods to choose from. We're just taking those things that we know are bad for most people and inflammatory, because that will block your body's ability to improve. So that's enough for part 1. Part 2, actually, I'll have to go back and refresh just a little bit with you. In the year 2000, I met Dr. R. Paul St. Amand, and today he's 88 years young and still working, seems like 24 hours a day, MD. And he's also a researcher out of UCLA. So he had the capabilities to do research on the problem that he's been having for 60 years, as a matter of fact. And so with this, he developed a protocol. And then what I did was I refined it a little bit. He has written numerous books. I've written my book, Fibromyalgia, Falsehoods, Fakers, and Facts. His is more research involved. Mine is more clinical, working actually with patients. Fibromyalgia itself is a cyclic progressive illness. It's very disturbing, because it affects millions of people, regardless of race or sex. Now look, you might have heard that females are affected by this much more than males. And I have found that males are very close to females in this, but because of ego, let's put it that way, males do not go to the doctor as often as females. Females are much more efficient in doing that. And also, when you go to a doctor, it's very confusing. The symptoms, they cluster, they reoccur. There's no objective positive tests objective tests are your x-rays, your blood tests, your urine tests, and so forth, MRIs. Those all turn out negative for fibromyalgia patients. And so allopaths are confused by this. The MDs and DOs, they're not trained in something like this. They're not trained in evaluating a patient that just comes in with symptoms of which a objective diagnosis can be made. And so because of this, they put you on various medications. It's kind of a guessing game, symptom-driven. And the problem with that is you can come in with stomach problems one day, then rashes another day, and then headaches another day. You're going to 3, 4, 5 different doctors. The medications are ineffective, oftentimes mind-altering. They might refer you directly to a psychiatrist, so forth and so on. The diagnosis is inconclusive because they really can't figure out exactly what it is. They can't put their finger on it, and plus the fact that no two patients are alike. It's very, very frustrating. So what we do is we step away from that objective testing. Our program is based upon history and symptoms, history of the patient itself, how long they've had it, and the other family members, so forth and so on, and symptoms. Which can be so wide and varied. Like I say, that's a totally different program from that which we'll be talking about today. There is the test, the 18 specific points, but for those that have chronic fatigue, their pain symptoms may vary quite a bit. They don't have the same symptomatic reaction as fibromyalgia patients. We do use the 18 points to find out, and we can use that also as the patients improve, but it is not the major thing that we use. What we actually use for our diagnosis, like I say, is history, the symptoms itself, and something called mapping that we're going to get into in just a few moments. But that's the most important thing. Dr. St. Amand found in his tests, along with other people, that there are genetic mutations, and most likely fibromyalgia is inherited. We usually check with the patients that come in, and they'll tell you that, yeah, some of the other family members will have it, or they'll say the doctor kept on telling us growing pains, and now they're 40, 45 years old. They don't think they're growing anymore, which is very, very true, and so that's a real problem. Fibromyalgia is triggered to a higher degree by some physical, emotional, or chemical trauma. And that's the interesting thing about it, is you can be achy and sore and so forth, and some doctors will just tell you, well, take more vitamins or do more exercise, so forth and so on. It's a low-lying type of fibromyalgia. I've had patients come in that have very minimal symptoms, and I've had patients come in literally wheelchairs, holding onto walls, unable to walk, so forth and so on, bedridden. After this, I'm going to have to go to a home and visit with the patient that she's so sick she can't really get out of the house. And so that's how it is. That's how it goes. That's such a wide and varied form of treatment. Now, Dr. St. Amand found that guaifenesin is very, very important as far as treatment, because in his studies he found that fibromyalgia patients have excess phosphate and calcium in their cells. Now, you would think that calcium is great if you have a lot of it in your body, but if it stays in the cells, calcium is a muscle stimulant, and so your muscles are constantly in a state of activity, and oftentimes that's why, number one, you don't heal properly, and number two, you have a very, very difficult time as far as sleeping is concerned. So if your muscles are constantly in activity, you don't get that deep REM sleep because your body's at that much higher level. The excess phosphate burns out something called the mitochondria. You've seen the commercials on TV, the ever-ready batteries. Well, you have these trillions of these things called mitochondria that produce your ever-ready battery energy. It's called adenosine triphosphate, or ATP. As I'm talking, as I'm blinking, as I'm moving my head and my hands, all of those require energy through adenosine triphosphate. But for fibromyalgia patients, the mitochondria can't produce enough energy for you because of it stays in the cells. The calcium and phosphate stay in the cells. So that's another reason why we place patients on magnesium, our form of magnesium, which is 100% pure. So don't just go out and start popping magnesium into your body. You have to know how much and the specific type that you need to use. So what he found in his tests is that guaifenesin pulls the excess phosphate and calcium out of your cells, and you urinate it out. So if you take guaifenesin, which is a very, very Very, very safe, innocuous substance, even safe for children. Really, there are no side effects. This guafenicin has been in existence for years. Matter of fact, if you've seen another commercial, seems like the only commercials you have are drug commercials. Mucinex, that's guafenicin. What it does is it breaks up the mucus, and so you can expectorate and get rid of it out of your system. That's what guafenicin actually is, but very, very safe. Very, very safe. So we place patients on guafenicin, 300 milligrams twice a day to start. Depending upon their response and reaction, they'll go up to 600 milligrams after a week or two, twice a day. And what that does is that pulls the excess phosphate and calcium out of the cells. Now, at another part of the program is the mapping. And so what we do is we, with the patient's arms that are unclothed and legs, we do what's called mapping. And what we do is like this. I'll show you my arm. We'll take and we'll go across like this with our fingers and so forth to find lumps and bumps and fluid-filled areas. And then we place them on a body map. Not only the size, but also the sensitivity, and also whether or not they are hard or soft. You can have a lot of fluid under your skin. It is found that fibromyalgia patients have a lot of these lumps and bumps all over their body. So we map this, we put this on your body chart, so to speak, and as you go through the protocol, we'll keep on checking these, and they'll start to disappear, believe it or not. And by the time you get through the program, you'll have literally none of these left in your body. That's another way to test to find out if you're improving. The fourth thing is that to find out how much guafenicin that you need, there is a mapping area that we do look actually. Well, by the way, the mapping is not done for pain. It's to find these lumps and bumps and fluid-filled areas. For your pain aspect, to find out how much guafenicin you need, it's on the left side of the anterior thigh, from like the hip bone all the way across into the medial knee. And what we do is we put pressure on that area to find out if it's painful. With the proper amount of guafenicin, that pain will go away. And so that is a specific objective test to validate the amount of guafenicin that you need to take. And so it's 4 parts in our program. Number 1 is a complete history, an evaluation of symptoms and so forth, along with the 18 points just to find out and see whether or not a person has pain in a variety of different areas. That's a secondary thing. Second is guafenicin. Guafenicin pulls the excess phosphate and calcium out of cells, and you urinate it out. Third is the mapping, where we do this on every visit. We check to find out the patient's improvement. And fourth is that test from the left anterior hip bone, shall we say, all the way across diagonal to the medial knee. Put pressure on it to find out if you have any pain as you're going through the guafenicin treatment. The proper amount of guafenicin, we'll take that away in about a month or a little bit longer possibly, but usually it's about a month, sometimes sooner. So that's the part of the program that actually is active in itself. Now, as far as the mapping, you can't just do it yourself. You have to be trained as a physician or somebody that is working in fibromyalgia, and that's what we're doing. We're trying to train doctors in various areas of the United States and otherwise so that they can do mapping properly. Some nurses and so forth have been trained in this as far as to do the mapping is concerned. Oftentimes they work with the doctors in itself, some physical therapists, some other health professionals. But the doctors that actually work with fibromyalgia are probably the best ones, unless you're in a rural area and that's the only thing you can depend upon. And so that's a secondary aspect. Again, the amount of guafenicin, that's a direct contact with the doctor. I know a lot of patients start going on guafenicin and they take huge amounts of guafenicin without even knowing and checking what they're doing and so forth. This is a program that's at take-home, so to speak, program, but with the direction of a trained doctor in the program of fibromyalgia treatment itself. And so that's why that's extremely important to do that. Again, if you're in a rural area, we try to show you videos. I have YouTube videos on how to do each and every one of these things to try to help you. I wish I could reach my arms out to help. If you have a doctor that is not cognizant in this program and is interested, please get in touch with us so that he can be trained properly. So we're going to do the next time, the third part of the program here is to review everything with you so that you understand exactly what we're doing, and that if you need assistance, if you need help, we're here for you. This is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. This is not a chiropractic treatment, okay? However, as I mentioned to patients, look, if you have osteoarthritis or other conditions that are secondary, that are actually made worse by the fibromyalgia, yes, we have treatments for that. Okay, very general chiropractic treatments. We also do some physiotherapy modalities, acupuncture, a variety of different things, and we find that those are very, very helpful to take care of what we call the white smoke or the secondary conditions that oftentimes linger past our treatment. We're not going to reverse rheumatoid arthritis, or osteoarthritis, or MS, or all the other ones that patients may have. But if we take care of the fibromyalgia, that should reduce the symptoms on all the other conditions, believe it or not, that are mimicking fibromyalgia. Thank you so very, very much. I want you to have a wonderful week, and look forward to next week when we review everything for you and answer all your questions. Marla, all the rest of you, thank you so very, very much for joining. And I look forward to any answers, questions, anything you may have, or concerns. Take care. Have a great week. I will see you next Monday, 12:30 p.m. again. And we're going to talk more fibromyalgia and related subjects. Thank you. Have a wonderful week again. Bye-bye now.